Joe and I, Joe Sergi and I, are making this presentation. We have a total of 10 minutes between us, so I'm just going to talk for a few minutes, and then Joe's going to talk for a few minutes, then we'll take questions and answers. Essentially, he and I have just completed a 3-year project on the history of well-being. This is a history which traces the concept of quality of life and well-being over a full 4,000-year historical period, with most of the time spent on the regional analyses since the Second World War. But the first part of the book deals with conceptions of well-being in Islamic societies, in Confucian, Buddhist societies, and so on, to try and provide a framework for it. One of our struggles, as you can imagine, in carrying out a project of this type, was to determine an appropriate conceptual framework that would inform both that 3-year study and a second book that we're now completing called Advances in Wellbeing, which will be released probably around February. We stay on schedule. But they're both very related. The second book is sort of a cliff note summary of what's in the larger book, so they're very much related. Our issue was around the conceptualization models. We identified 60 different approaches to assessing quality of life and well-being from the period of the Second World War forward. And as you would imagine, most of the early models were economic models, which is exactly what many of us have been struggling against for the last number of years. That is, to not define quality of life or the sense of well-being using strictly economic metrics, recognizing that life is much richer than how much money you have in your pocket and so on. So we've identified those, and we selected 2 models that would inform the corpus of the body of work that we did in both the pursuit of well-being, the untold global history, and the advances in well-being. The first one was the weighted index of social progress, which is mostly associated with my work, with just the index of social progress. The second one is the OECD, the Organization for Economic Cooperation and Development's Health Wellbeing Index. Joe's going to talk about that. I will just basically describe what the index of social progress consists of. It's 41 indicators divided across 10 sub-indexes. And these are sectors, sub-indexes, sectors of communal life that we've demonstrated over a period of many, many years to be the most important ones in terms of assessing quality of life and well-being. And I'm not going to get into the indicators that are used to operationalize it because we don't have time for that. But they represent the 10 sectors. This is the weighting system that's used. As you see, it was a combination of factor analysis and other methods used to come up with the item weights, the sub-index weights, and then the overall index weights put together in a very creative way. The methodology uses 160 countries, 162 it says here, and we have time series data beginning in 1970 for every 5-year period. So, and it's original data collected at the time from multiple sources. So we're now into almost 50 years of original data collection. It's a major source of information. Issues of missing data have been dealt with, and we can talk about that, and the time periods are also reflected there. The data sources are primarily United Nations. I should say they're country sources. Data provided by countries to international, non-governmental, or international governmental bodies that collect data in a coherent fashion. So the UN, the UNDP, World Bank, International Monetary Fund, all require member states to collect to report the same kind of data using exactly the same set of definitions. What's been very interesting about the journey is that the breadth and richness of data has increased tremendously since 1970. More and more indicators have come online, and of course we've been able to go into the archives and get data. And sometimes for whole regions of the world, for example, the Soviet Union, when it collapsed, we were finally able to get information on the separate member states, member republics of the former Soviet Union. And many independent scholars and non-governmental organizations, these are the 4 levels of analysis that the data are reported for. And this is what the data look like over that period of time, showing the decennial period and then region and the changes that have taken place. For me, one of the most important slides is this one, which reports progress in Africa for the first time, beginning in 2010. This is a dramatic shift that's taken place. I mean, Africa was in the doldrums, as you can see, fairly steady state for the better part of 40 years, but it's definitely launched and taken off in a very progressive direction at this point. And this is what it looks like at the global level using a single graph. And we have these graphs for each time period, so you can see the way in which the redness is dispersed, the pink the shades are dispersed around the world. So that's one method. I'm going to back up. Joe, this is yours now. The OECD. And if you want to just go into your slides that you created, that's fine.
Yeah.
Maybe just, if we do just one. So,
We've got a whole bunch of indicators out there, and some of the popular indicators, Richard's social progress indicator, one heck of an indicator set that has quite a bit of data. It's very rich. It's very well established. Same thing with the Human Development Index. The Human Development Index. The Human Development Index is also very rich, and it has continuity in the sense that we need a lot of trends and the like. The problem with some of the very well established indicators, like, for example, the Social Progress Index or the Human Development Index, and of course the OECD has its own index, is that they don't make distinctions between what some scholars talk about as outcome indicators versus action indicators. Action indicators are the kinds of indicators that ultimately guide public policy. Again, let me repeat that. Action indicators, which is different from outcome indicators. Outcome indicators are essentially, let me give you an example. This is the OECD framework of indicators related to health well-being. And let me make this distinction between outcome indicators and action indicators using their framework. And I think it's a beautiful framework because it has the potential of coming up with all kinds of other types of indicators and making those distinctions that would allow public policy people to connect the dots. Now what are the dots? Outcome indicators is this: health status, life expectancy at birth, life expectancy by sex and education, mortality from cancer, mortality from cardiovascular disease, mortality from transport accident, suicide, infant mortality, and so forth, right? These are outcome indicators. In order to affect outcome indicators, you need action indicators, the kinds of things that impact those outcomes, right? And therefore, action indicators based on much of the work that is done in health and well-being tends to be divided into three sectors: access to health care, quality of care, and healthcare expenditures. As a matter of fact, in any country, to assess the effectiveness, the performance effectiveness of the healthcare sector, you need to tap into these three. So in any country, when you say they have a good healthcare system, it's not necessarily that they capture this, they capture these. These are the action indicators. Action indicators because, again, what they do is they lend themselves to public policy action. Public policy action. Access to care, coverage for health care, unmet needs for medical care, unmet needs for dental care, and so forth. Quality care, avoidable hospital admissions, diabetes cares, and so forth. Healthcare expenditures, you know. So these things, right, affect this. But in order to be comprehensive, not everything that is impacted by public policy tends to affect those outcomes. So this is where this other thing comes in, which is non-medical determinants of health, like things that you don't have much control over, and you have to acknowledge and identify those. Tobacco consumption, alcohol consumption, fruit and vegetable consumptions among adults, obesity. I mean, of course, certain things you can do, and you can, well, we can argue that some of this connect with that, but nevertheless, this is something that you have less control over, and therefore it kind of it affects this in a way that may not necessarily be related to those action indicators. But what's beautiful about this model, this framework, is now we've got three main sets of action indicators. Now we can be a little bit more specific on what impacts those three dimensions of action indicators. And here the OECD spells out healthcare workforce and healthcare activities. These things affect access to care, quality of care, healthcare expenditure, and the like. And then, of course, there are these demographic shifts that impact those things. So healthcare workforce would be things like the overall number of doctors that are available out there, and they can break things down by age, sex, category, and so forth. Medical graduate, examples of indicators of healthcare activities would be, again, things like medical technologies that are out there, and again, those demographic shifts impact it. So again, what's beautiful about this is that we have a framework in which we're not only talking about outcome indicators, but we have action indicators, and this particular OECD framework allows you to connect the dots. Yeah, that's right. So, and I have to finish, but hold on, I have two other slides, but I'm not going to go through them.
But we have a printout.
Oh, okay. So here we have a situation in which, well, let's do the same thing with something like employment well-being, right? We can actually come up with another framework that does exactly the same thing, in which we say, okay, well, income is an outcome, yes. We can talk about GDP and so forth, but we have to essentially spell out what are the things that we don't have much control over, and yes, we need to measure those. But again, comparable to the OECD framework, we can talk about access to the labor market, the quality of jobs, expenditures, you know, on economic development. These are the things that ultimately affect economic well-being, right? And what are those things that influence those three major dimensions? And again, we can spell those out. This kind of framework allows you to, again, connect the dots.
Why don't we take a couple of questions? Thank you, Joe. Hey,
Joe, I have a question for you. Going back to the other slide, in terms of
to the health well-being.
the health well-being, that is an extremely narrow view of
OECD thing?
Yeah.
Wow.
What happened to access to public transport, access to affordable housing, access to education, which all influence these health status indicators on the slide?
But that's no problem. What you can do is you can feed those other indicators in this screen. If you're not happy with those, and add or delete whatever you like.
But isn't the OECD's,
That's the
Right.
easy, right.
how do they not take into account the other broader determinants of health? The social determinants.
Yeah. It's a valid question. Every model has its severe limitations. No question about it. This one is already very rich, very elaborate, but it does exclude those very things that you're talking about, that we know to be directly related to health in this case.
So when it comes to transportation, maybe you can add it, where would you add that? How does that fit?
Access to health, access to care. It's-
Access?
Yes, the third column up at the top.
So,
It is so important, so that for them not to be there.
Yeah,
wouldn't
yeah,
be real
it's
concern.
very obvious there.
okay, access to this
But
transportation.
the conceptual model itself, showing the relationship between the inputs, the throughputs, the outputs, and the social investments, this is extremely valuable. But within that, you tinker with it to make it fit.
Yeah, just to add on that, another obvious thing that is missing is environmental factors, and air pollution, water pollution, things
Well,
like
that's
that.
the
Number
uncontrollable.
of sun hours that you don't get depressed, I mean, this all has an effect on health, right?
Right, so you add those here?
Yeah, we should add those here.
Yeah, into environmental conditions.
Particularly because if you're gonna do community planning and using a model like this, it's like all these factors are just externalities, you know, we don't account for them, we don't understand the link to them, so, you know, it kind of really concerns me that the OECD would be influenced by that.
Right, but there's also something to be said for parsimony. If you can't, you can't take into account everything because the model becomes overwhelming and then it doesn't become workable.
But we know theoretically that they are determinants. It's not like it's a thought, it's proven, it's
Yeah.
evidential.
Other comments, or questions? I'm just terribly mindful of time, that's all.
Is there empirical work to corroborate these associations and how important they are? And then if you have empirical work, you may know how much you are missing in explaining the outcomes with the inputs you have.
There is some publication related to the OECD.
At the empirical level, or this is basically
No, at the
conceptual?
empirical level. There is indeed, this is the conceptual piece, but OECD always has backups in terms of, you know, that's one of the things those OECD is known for, is its rich empirical data that are available to support its work. So they're there, they're on, I know from the Director General.
And a short question, may I, to you? If you were able to incorporate 3 additional variables to the index, and let's suppose that the information is available, what variables or dimensions would you incorporate now?
Variables or sectors?
Or sectors or something, additional information?
I would include
Which is
the
not there.
family as a sector, a population group, the family itself, and a way of measuring family stability. And there are obvious things like divorce rates, family violence, and so on. But the data aren't collectible across all nations. And that was in the early model and was excluded. But that's one that I always had hoped to be able to put back in. So that would be the major one, I think. But covering 10 sectors is really quite a lot.
Ready to move on?
I think we